we don't have midwifery as standard in this country. What gets in the way is people still don't recognize and understand what midwifery is. Everywhere else in the rest of the world, you're going to know that the community knows what a midwife does and why.
How can midwifery be a part of the solution for improving the maternal health system for Black women, all birthing people, people in communities? What can we do? What gets in the way of it being a part of the solution? And I want to start there. So let's just start with what gets in the way.
I think where we go wrong is not realizing that midwifery is a dire necessity. It's not an accessory. It's not just a cute project, right? Where we could do better in terms of the workforce is really trying to address the issues as a whole and acknowledge the structural inequities that lead to them.
Yeah, what gets in the way is that we don't have midwifery as standard in this country. What gets in the way is people still don't recognize and understand what midwifery is. Everywhere else in the rest of the world, you're going to know that the community knows what a midwife does and why. Midwives are the guardian of normal. They are standing in that gap with every person at every step of the way in the maternity journey. So what's getting in the way here in the USA is that we no longer depend on midwifery like we have done for centuries to manage and support the birthing population. Rather, we've turned it into a crisis, into high risk, and we have folk who are like-minded attending to the maternity care. And that is where much of these outcomes are coming from.
You know, if healthcare providers like myself, like you were saying, were, part of their medical education was to actually understand, to actually go out into the homes with, a midwife, to accompany a midwife and understand, the value that they have and the sanctity of their relationships that they have in their, with their patients. I do kind of feel like there could be a better solution for everyone.
What advice would you give to the younger version of self, just getting started in midwifery, advocacy, in this aspect of work? What are some pieces of advice you would give to someone just getting started?
Definitely being present. And that's like being present for myself, being present in my body, but also just being present with my people and slowing down.
Stay humble without, just back off a minute, like zip it. The humility that is needed to be able to be open every single time. That's why we made our tagline at Commonsense Childbirth, every person, every time. Because that encompasses everybody then, right? But the not putting yourself in the center, because you don't belong there, right? Move out so that there's room for that client, that patient, that person to be centered authentically and wholly and, holistically every single time.
Really take the time to understand a community and to as you're saying, Jenny, be humble, but to learn and to take your cues. It's sort of like sometimes I think leadership is thought of as a very individualistic endeavor, but my career has been all over the place just because I'm following the lead of my community partners, and so part of it is around like just making sure that you understand, like how service to community can be instructive and fulfilling. And then also to kind of just have some imagination. I think we're really kind of like molded into a very, very sort of like narrow scope of what we think is possible, and so just having the ability to kind of see outside of, that box is something, maybe my younger self was probably better at it even than I am now, because young people, tend to actually have that.
Change has come slowly, particularly in this space around midwifery, in birthing, the whole birthing conversation. What gives you hope?
It gives me hope to be in community. I am a person that sits under my elders quite a bit. And that's just knowing that it's not a new issue, knowing that people have always been committed to change, deeply gives me hope. My daughter is the most argumentative person about every issue that she confronts in her day-to-day life with others, and she challenges so many different narratives. So to see that she's just like picking up certain pieces and activating around them on her own really gives me hope for what the next generation may do.
For me, it's been, not just hopeful, but also sort of like nourishing and energizing to be able to work with young people. And that could be like, kids in preschool. It can be, kids in middle school. It can be young Navajo women who want to do research, using indigenous methods. So I have hope for the next generation.
I see the folk who get it, who understand that this is justice work, that this is our fight for our liberation, and it's not just, social justice, it's birth justice, maternal justice, reproductive justice, economic justice, right? Like these pieces interwoven into getting to better healthcare outcomes and, better healthcare structures have me hopeful that maybe a couple of generations away, but we are on our way again. And I think we'll be okay if we can just hold the line and hold each other.
For more conversations like this, subscribe to our YouTube channel and learn more at meetattheintersection.org.